which mom is not stressed out of her mind at this time, like everyone's talking about inductions and staring at her like that watch pot that never boils kind of thing. If I catch women in early pregnancy, I often encourage them to do a little white lie and just say like, oh, my doctor just told me my due date is changed and it's 2 weeks later than it really is. And this is to tell your friends, your family, so everyone can leave you alone. Because that time between 38 and 40 weeks, as we all know, is so incredibly stressful. And if someone's mom comes in from out of town to help her, she's like, are you feeling anything? And it's just stressing people out. So I do encourage them to say, oh yeah, instead of July 15th, it's at the end of July, saying something like that. And I do feel like it helps the stress later on, kind of thing. And if you guys have questions, just say the word. So acupuncture helps with cervical ripening, relaxing the muscles, the sinews, all of that, and it's just fabulous. So as an acupuncturist, it's been interesting to fit into the birth scene. 95% of my births were all in California and San Diego. So people are like, what are you doing here as an acupuncturist? So I'm constantly teaching and educating the nurses, the staff, how we can help. So, and I recognize like my scope is acupuncture. So even though I am a doctor, I would never introduce myself as a doctor in a hospital because I'm not a medical doctor. And so I think it's important for us to mind our roles. A doula is a non-medical provider, so it's like we kind of have to just know our scope. If my patient looks at me, and I'm acu-doulaing her, and she says, how's the baby look? I'll look at the nurse and say, nurse, can you help us here? Because that's not my job, it's her job. And like including them and showing respect for the others is just something really important for me. So fitting into the scope of birth, being part of the pregnancy care team is really important for me as an acupuncturist. How about massage? Who's received massage? Have you guys all received some kind of massage? Okay, that's good, because a lot of this is touch and body work, and so it's just getting comfortable with the person in front of you. So really taking a moment when you're first going to do acupressure with somebody of grounding yourself. We were taught Qigong, where we would do some like breathing exercises and kind of clearing our minds so that we're really focused on the person in front of us. Let's see, and then you guys probably know this as doulas, like we can really shift the energy when we walk into a room and it's high stress, whatever's happening, to, you know, calming, turning the lights down, getting her to calm down, doing deep breaths, picturing her desired outcomes, repeating her mantras, her meditations, all that stuff. Let's see, so I am going to talk about the specific points, and then I figured we can practice on one another. There's body points, and then there's ear points that we're going to go over today. So try to make it as easy as possible for you guys to understand. So I had the photo release form just because I take videos. I teach all around the world, and it's just so important for me.